local geographic markets for private insurance are very different, and hospital referral markets are also very different. And so depending on whether you're in a state like Alabama, where Blue Cross Blue Shield of Alabama has 80% of the patients, versus other regional markets for health insurance, where it may be very competitive and a large number of payers competing for the hospital's business, then it really changes the dynamics between the hospitals and the payers. There's a large number of different payment methodologies that are used, and of course the hospital and private payers methodologies range from everything from total capitation-based payments to really cost-based reimbursement and everything in between. And the contracts are negotiated from between each hospital and each individual payer, and often an individual payer like WellPoint may have multiple different plans. So even a single hospital may have multiple different contractual relationships with the same payer. So it can be very, very confusing, and often hospitals are operating in an environment with multiple simultaneous and conflicting financial incentives, so it can be very difficult to navigate. The implication for innovators is you have to understand the payer mix in each geography. You need to understand who are the key stakeholders. You need to understand what's your key value message or messages, and how can you prove that. And if you understand those, then it becomes easier to prioritize, because there's going to be one or more key payers that you need to be successful with, and one or more key value messages that you need to deliver. So it makes more sense to simplify rather than to understand every individual payer, but focus on what matters.